We're ready to go.
Okay.
Hello, I'm Almija Cooper. I'm the National Manager of Health Justice at Mons Clean Air Force. I am thrilled today to have as my guest Dr. George Benjamin. He is one of the most influential healthcare and health policy leaders in our country and in the world. As the CEO and physician leader of the American Public Health Association, the APHA, he is known for eloquently and passionately speaking about all of the important healthcare issues that impact us today. And in particular, he is very well versed on the topics that we'll be talking about today in terms of healthcare and climate change. He's board certified in internal medicine and a master of the American College of Physicians. He's also been the chief of medicine at the Walter Reed Hospital, and he's the author of Public Health Under Siege, which I think we feel today particularly. It certainly feels right now that for our 2 million moms, dads, and caregivers who fight for better, clean air and climate policies, that we are thrilled to have Dr. Benjamin with us today, also known as Dr. B. So let's dive right into our questions. As the CEO and physician leader of the largest and oldest public health association in the world, you include environment and health among your priorities. Please share with our audience why climate change is critical to public health and to APHA's advocacy and mission.
For the first 20 years of my medical experience, I was practicing emergency medicine as chief emergency medicine in the military, and then in city hospital, and then in public health. And what I've discovered, both as a practitioner and then now as climate change has accelerated, that is probably the most important public health issue of our day. It impacts so much of our ecosystem, that it impacts every aspect of our health, from infectious diseases to our food systems, to the weather, to toxic exposures, to physical injury. And those impacts are long-term. So it is a significant problem that has so many aspects. And I think American Public Health Association has been very concerned for many years about the warming climate, the fact that our climate is changing, and that it if you want to really make people healthy, the best way to do is to deal with things outside of the doctor's office, as well as inside the doctor's office. And climate change is one of those issues.
On a personal level, Dr. B, how do you view the connection between environment and public health? Was there a specific moment or event that led you to feel the critical and urgent nature of the relationship between these two?
I had some of my members sit me down several years ago and kind of help me connect the dots, and everybody knew the climate was warming. That wasn't a surprise, but they're making me more aware that we had more heat in places that we hadn't seen before, more cold weather in places that weren't seeing that kind of severe weather before. Migratory aspects of infectious diseases, more Lyme disease, more ticks, those kinds of things. And so while I can't tell you that there was a specific event, there's certainly a constellation of my understanding of what I was actually seeing and why I was seeing it. And the fact is, because we're in public health, we're always thinking prevention. The epiphany for me was this was preventable.
Thank you so much for sharing your personal thoughts with us, Dr. B. Let's move now to a subject that is of deep concern to MOMS members. MOMS members have been deeply concerned about an action of the Environmental Protection Agency and its administrator that they have made that Administrator Zeldin has made a determination that the EPA is not responsible for protecting the public from climate pollution and has eliminated rules that are intended to cut out tailpipe pollution, fueling the climate crisis and harming people's health. In short, what most people refer to this as the repeal of the endangerment finding. The APHA is suing the EPA for taking this action. What does it mean for our children and their families if this determination of the EPA is allowed to stand?
The endangerment finding was a designation to recognize that the pollution that comes from cars, in particular, um, poisoned our air. And so we've worked very hard to try to do things to reduce that pollution. And if we don't continue to do this, and the reason APHA sued is because we knew that it would cause more asthma attacks, particularly in our kids. So lost school days, in addition to the sickness and illness that occurs, more heart attacks, particularly in our middle age and seniors, more heat-related deaths, particularly among the older folks and even the youngest among us, means more winter storms, more severe rain events with floods. And we've seen tragedies of some of these floods that have happened in some of our communities, even in the last year. So by repealing the endangerment finding, they're putting us more at risk, but it's not one of those theoretical risks. It's the fact that climate change is here today, it's impacting our health today, and this is going to accelerate people dying from preventable diseases. And that's why we're involved in this on a legal basis.
Thank you for that, Dr. B. I'd like to switch gears for a moment and share with you that our motto at Moms Clean Air Force is justice in every breath. Would you share with our audience what comes to mind for you when you hear those words?
We talk about health equity and the point we want to make sure everybody has an opportunity to achieve optimal health. And we live by that creed here in public health. And that's a good slogan for moms, because what happens with climate change is that the people who are least responsible for the changes in our environment, the poisoning of our environment, are the ones that are dramatically impacted, both physically and economically. So as a matter of just fairness, ultimately justice, making sure that everybody has equal access to clean air, can live in an environment that's free of toxins, particularly when we know that there are things that we can do to prevent that from happening. And that recently, many of the actions of our federal government has been to make us less safe each and every day. That's appalling. And so Mom's slogan is right on target. And we stand firmly behind your efforts there.
Thank you. We've been talking about some pretty heavy topics, very serious. What gives you hope as you do this work?
The fact that we have the average citizen who's been able to connect the dots and are advocating for the safety and well-being of our community. It tells me that we have societal cohesion, that the people in our community are pushing back on things that are we see that should not happen in our society, and so we want to have people who are trusted messengers. Moms, grandmas, mothers, sisters who are concerned about the well-being of their families, speaking up, and that gives me hope. And I'll tell you one other thing: my grandkids. Because my grandkids understand the impact of climate change. They understand the difference between weather and the climate. And my grandkids, 14, 12, and 8, are rabidly environmental activists in the nicest kind of way.
Oh, that really resonates with me, Dr. B. I have a 7-month-old grandson, and it inspires me to do this work as well. We've talked about our grandchildren, we've talked about environmental health, the endangerment finding. As we're closing out our conversation, for the parents and caregivers who are in the audience today, What meaningful actions would you recommend that they take to protect their families and to advocate for cleaner air in their communities?
First of all, I encourage everybody to do everything we can to reduce carbon pollution in our own communities, so lowering our carbon footprint, so we use less energy in any way possible. And there are lots of lists. If you go to the apha.org website, you can find opportunities to lower your carbon footprint and things you can do at home. But I think the most effective thing right now you can do, in addition to that, is to write and call your elected officials. Tell them you want clean air, clean water, safe food, and that EPA is a public health agency and they ought to act like it.
Dr. B, as we close out, is there any closing message or any topic that we didn't touch on that is a burning issue for you that you'd like to share with our audience?
I think that far too often people think that climate change is inevitable. It's something that we can't do something about. But the truth of the matter is, all of the evidence is there that we can do something about this. The cause of climate change is just good old common sense. If you poison the air, people are going to get sick. And I don't think there's a simpler message than that. Poison means illness. Prevention means not getting sick.
Thank you so much for joining us today. It's been a terrific conversation and great content, great message for our audience. And I'm going to close out now with some actions that our viewers can take by going to Mom's website. There is a call to action on a petition to tell Congress to hold Zeldin accountable for continuing EPA's mission. And if you go to the Mom's website at www.momscleanairforce.org, you can find that petition, and please sign up because of all of the reasons that we have discussed today in our conversation. Thank you again, Dr. B.
Thank you, Mina.
And we see on the screen and the QR code, hold Zeldin accountable for corrupting EPA's mission. And you can contact at the